Hi everyone, welcome to this education session. Today we'll be talking about the QADS forms, otherwise known as the Queensland Adult Deterioration Detection Tools. We'll also be talking a little bit about the medical emergency teams that work within the hospitals and just a few barriers, I guess, that you'll find within the hospital. Please don't forget to fill out the review form that I have emailed you and return that to me by Sunday afternoon would be great. Thanks guys. What are QADs and where do they come from? The Adult Deterioration Detection Tool was originally developed in Queensland at the University of Queensland, but has since been adopted across the world. It was developed using 25 different observation charts that were pulled apart to identify the usability issues. A series of new charts were then formed and critiqued by health professionals and were eventually narrowed down to the basic design Queensland hospitals now use. You can see an example of them here on this slide. With the use of this new monitoring form, it was noted that there were less errors in documenting vital signs, and nurse decision times in regards to patient emergency care were improved. The new QADS forms recorded 9 different vital signs, and observations were given a score. The scores are then tallied up, and the total of the QADS score determines the action the nurses need to take. The 9 vital signs chosen to go on the QADS form were respiratory rate, blood pressure, 4-hour urine output, oxygen saturation, heart rate, consciousness level, oxygen therapy flow rate, temperature, and pain level. These observations were then listed on the QADS form in order of importance, starting with respiratory rate and oxygen saturation, and finishing up with increased pain. As you can see, this is the order that they're listed on every QADS form. So why are QADS forms so useful? Early deterioration detection tools, such as the QADS used here in Queensland, mean patient deterioration is picked up quickly. The sooner the patient deterioration is picked up, the better the outcome is for the patient. Studies have shown a reduction in cardiac arrest calls and unexplained intensive care unit admissions as a direct result of using a rapid response system that highlights patient deterioration early. There is research to support that up to 80% of in-hospital cardiopulmonary arrests are the result of prolonged periods of instability of vital signs. QADS work by collating the 9 major vital signs in a way that shows when values variate, even in the slightest of ways. With the use of the QADS, nurses can clearly see when multiple vital signs are changing, and if necessary, call the medical emergency team, who will then in turn assess the patient thoroughly and organise changes in care in order to halt or reduce the deterioration of the patient's health. As mentioned earlier, a rapid response program like QADS gives a score that the nurse can then use to make the appropriate decisions on whether to call the medical emergency team. Using a tool like QADS should result in the reduction of patient deterioration slipping by unnoticed. With the development of the Adult Deterioration Detection Tool came the formation of the Medical Emergency Team, sometimes known as the Medical Emergency Response Team. These are specially trained teams set up in hospitals to attend medical emergencies in the hope of preventing cardiopulmonary incidences and unnecessary ICU admissions. By having these teams in place, it removes some of the stress and strain on nursing staff that might be otherwise practicing outside the scope of practice or too nervous to contact a potentially dismissive attending doctor. The medical emergency team responds similarly to when dealing with a code blue. However, because they are acting before the patient has deteriorated that far, the patient outcome is significantly improved. In Australia, the teams are made up of nurses and doctors with advanced life support training. Similarly to the Adult Deterioration Detection Tool, medical emergency teams were first developed in Australia and adopted later by other countries. Before the creation of the medical emergency teams, nursing staff would try to manage deteriorating patients. However, staff were lacking the expertise to adequately bring a patient back from the brink of severely ill health. From time to time, medical emergency teams will determine if a patient requires end-of-life or palliative care rather than resuscitative treatments. This saves the hospital money as well as saving the patient from undergoing unnecessary invasive treatments. In the next couple of slides, I'll be showing you some examples of where adult deterioration detection tools like QADs have been used to help patients. This is Bill. Bill's an 81-year-old male who was admitted into the hospital with a respiratory infection. During a routine set of morning obs, it was discovered that Bill had an increased respiratory rate, a decreased oxygen saturation level, and decreased blood pressure. Bill had stated to the nurse that he had not had much to drink during the morning, so the nurse encouraged him to drink a couple of glasses of water and told him that she would come back and check his blood pressure in about half an hour. When she came back and checked his blood pressure, the water had no effect, and it was still quite low. Due to the high respiratory rate, the low oxygen saturation levels, and Bill's increasing level of discomfort, the nurse decided to call his doctor, and the doctor ordered an X-ray. It was discovered that Bill had hypervolemia. As a result, the doctor ordered a stat dose of diuretics, and Bill was put on an immediate fluid restriction. Without QADs, Bill may have been left longer with the assumption that the discomfort he was feeling was just from his respiratory infection. More severe consequences was avoided for Bill because the nurse used QADs, and the QADs indicated that there was actually something seriously going wrong with him. This is Ted. Ted is an 89-year-old male with dementia who is waiting in the hospital for a nursing home placement. During a routine set of OBS, it was discovered that Ted had a respiratory rate of 27 breaths per minute, a decreased oxygen saturation levels, increased blood pressure, increased heart rate, and a slight increase in temperature. The nurse called the doctor, and the doctor suspected that Ted had a respiratory infection. A stat dose of IV antibiotics was administered. While waiting for the IV antibiotics to be written up and take effect, Ted's respiratory rate increased to 44 breaths per minute. The medical emergency team was called, and Ted was monitored until the respiratory rate dropped to safer levels. A code blue was avoided. This is Jess. Jess is a 24-year-old female who has been admitted into hospital for surgery. It's the day after surgery, and during the routine morning obs, done before getting her out of bed for the toilet and the shower, it was discovered that Jess had a decreased blood pressure and decreased heart rate. She said that she was feeling dizzy and nauseous when she sat up. The medical emergency response team were called, IV fluids were administered, her blood pressure and heart rate increased to acceptable levels, and this meant that Jess avoided any further complications, and she also avoided a fall and further injuries from that fall. This is Joan. Joan is a 65-year-old female admitted to the hospital for surgery. She's a post-op patient and has only returned from the operation in the last hour. During her post-op observations, it was noted that Joan's blood pressure was 90/56. Usually you would call the medical emergency team if the systolic blood pressure was below 90. As you can see from this picture, this lady looks quite bright and not the usual grogginess that you would expect from after surgery. And that's how Joan was. That's how she presented to the staff. She was quite bright, quite happy, quite able to talk, no grogginess at all. She was talking to the staff, she was reading a book, doing her puzzles, and when we asked her if she felt dizzy, she said no. We called the doctor anyway, because her blood pressure was really quite low, and he ordered a stat dose of an IV flush. Her blood pressure increased to 104/58. This meant that we were able to avoid calling the medical emergency team, and also meant that there was no injury to the patient due to falling over from the low blood pressure. Whilst the adult deterioration detection tools are an asset to our healthcare system, There are a few barriers that must be overcome in order to make them successful. A study in Melbourne proved that not all vital signs were being recorded by the nurses, and observations were occurring more than 6 hours apart, resulting in the patient deterioration not being picked up early enough. The study noticed that blood pressure, oxygen saturation levels, and heart rate were all being measured and recorded, but respiratory rate was being neglected. A solution to this problem may be conducting documentation reviews to ensure all 9 vital signs are recorded at least once every 4 hours, and more often in acute situations. Another barrier to success for the adult deterioration detection tools is that there are some nurses who revert back to the tradition of calling the doctor rather than calling the medical emergency team. This hurdle can be overcome by retraining and re-educating nursing staff on the proper use of medical emergency teams. Finally, for the adult deterioration detection tool to work, the medical emergency team needs to be in place to support it. These teams are expensive for nurses to employ, and therefore hospitals are likely to only employ a bare minimum amount of teams possible, while some smaller hospitals may not be able to afford a team at all. With minimal staff for the medical emergency teams, a deteriorating patient may not be seen to because With minimal staff for medical emergency teams, a deteriorating patient may not be seen to because the teams are already attending other patients. Another problem arising from minimal access to medical emergency teams is that nurses will be hesitant to call them until a patient is almost beyond help. The only realistic solution to this problem is a bigger budget, but that is unlikely to happen in an industry that already has a very stretched budget. So let's summarize what we've learnt today. The adult deterioration detection tool, like the QADS forms that we use here in Queensland, are an early detection tool that record vital observations. There are 9 vital observations recorded, and they're recorded in the order of vital importance. By using QADS forms, we reduce the incidence of cardiopulmonary arrests, and we reduce the incidence of ICU admissions from the hospital. By using these forms, we can see when patients are deteriorating, and when they are, we can call the medical emergency teams. These teams help treat the patients before a code blue is needed. It's important to record the vital observations accurately and call medical emergency teams if the patient health deteriorates. I'd just like to say thanks very much for listening to this recording. And if you can just fill out the review forms that I've emailed you, I would really appreciate them and get them back to me by Sunday afternoon. That would be great. Thanks very much, guys. Bye.